All right, so I'm checking the outside, making sure there's no precautions, there's no red flags that I need to be aware of. I don't see anything, so I'm going to go ahead and knock, knock, knock. Hello, my name is Aubrey. I'll be your nurse today. Okay, I'm just going to do some hand hygiene. Can you tell me your last name and date of birth?
Harrison, 12/30/92.
Perfect. I'm also just going to verify that with your band. Perfect. Thank you. Can you tell me where we're at today?
Bellevue College Hospital.
Perfect. And do you know the date?
It is the 12th of July.
Perfect. Okay. And I'm just going to look around here. I don't see anything. I don't see any devices. Do you use any walkers, canes, dentures, any other devices to help you with your daily living?
No.
Perfect. Okay. Your vitals look good. They've already been taken, so I'm not going to do those again. Okay. I'm just going to ask you some questions about your health history, and then we're going to move on to an assessment. Okay. All right. Do you have any history, like family history of like diabetes, heart attacks, any chest pain? No. Any shortness of breath? No. Any dizziness? Any tingling in any extremities?
No.
Perfect. Okay. Any coughing?
No.
No. Any like nasal congestion, flu-like symptoms? Perfect. Okay. Any constipation, diarrhea?
Constipation.
Constipation. Is that why you're here today? Perfect. Okay. Are you having any pain with any of that?
No.
No. Perfect. Okay. Any history of like depression or anxiety?
No.
Any thoughts of harming yourself or anyone else?
Mm-mm.
Good. Okay. Any how are you sleeping at night?
Pretty good.
Pretty good? Okay, perfect. Any allergies I need to be aware of?
No.
No. All right. Do I need to be aware of any spiritual considerations, things that we can help you stay here better?
No.
Perfect. Okay. Well, in that case, we're just going to kind of jump into your assessment, and then I'll get in and get out, and we'll be good to go. Okay. All right. So I'm going to put some gloves on, and then I'm also going to clean my stethoscope. I'm just going to wipe that down. Perfect. Okay. So as I'm looking just at your skin and face, everything looks symmetrical. I don't see any skin breakdown. Your trachea does seem to be midline. I am going to touch your head. Just kind of feel around, make sure there's no lumps, bumps that we need to be concerned of. Okay, so if you can go ahead and just lean your head forward. Perfect. I don't see any lice or anything like that, which is perfect. Can you go ahead and look that direction for me? I don't see any jugular vein distension. Can you look this way? This way for me. Sorry. Thank you. All right, you can go ahead and look straight ahead. Just going to feel your carotid here. It is nice and strong. I'm also going to do the other side. Perfect. Okay. Again, I'm not seeing any skin breakdown. The color, the temp looks really good, feels good. I'm now going to do some tests, some cranial tests or nerve tests, just to make sure everything is good. We're going to start with your cranial nerve number 1, which is smell. So go ahead and close your eyes for me. I'm going to crack this open. Can you tell me what you smell?
Alcohol.
Perfect. Thank you. All right. You can go ahead and open your eyes. We're also going to test your cranial nerve 2, 3, 4, and 6, which is optic. So I'm going to walk over here. Can you tell me what number you see that I'm holding up? 4. Perfect. All right. I'm also going to move my finger, and I just want you to follow it with just your eyes, okay? So we're going to go this way. We're going to go in 6 directions here. Perfect. And then keep following my finger. Perfect. Okay. I'm also going to flash a really bright light in your eyes. Okay. Perfect. Pupils look good. All right. And then while I'm just at it, go ahead and open your mouth for me. Looking in here. I don't see any cracks or any ulcers or anything like that. Can you stick your tongue out and go, ah? Then go ahead and move your tongue side to side. All right. And then close your mouth and dry swallow. Just kind of at the same time we were testing your cranial, I want to say. We're going to move on because I don't remember. All right. But we'll get back to that. Go ahead and puff your cheeks out for me. Perfect. And then smile and frown. Can you scrunch your eyebrows? Perfect. Lift those eyebrows up as wide as you can. Perfect. All right. So that was 5 and 7. Okay. And then so your mouth that we tested was 6, 8, 10, and 12. I'm sorry, not 8, because 8 will be hearing. So now I'm going to move on to hearing. So go ahead and close your eyes for me. Can you tell me what you're hearing on what side?
Right side.
Perfect.
Left side.
Perfect. All right. And then you can go and open your eyes. We're also going to do 11, which is going to shrug your shoulders for me. Perfect. Okay. So I'm done with your cranial nerves. Everything is looking good and normal. So now I'm going to move on to your upper extremities. Okay. So can you go ahead and lift your arm up for 1 minute? Perfect. You can go ahead and put that down. Can you do your other one? Perfect. Can you squeeze my hands for me? All right. And then I'm also going to check your pulse here. Feels good. I'm going to move down. Feels good. All right. And I'm also looking, skin looks normal, feels, temperature is good. Can you feel that? Perfect. Sensation is perfect. Can you wiggle your fingers? Awesome. Also going to check your capillary refills, which is under 2 seconds. You can go ahead and set those down. I'm now going to listen to your lungs. Okay. And I'm also going to listen to your heart. Okay. I'm just going to feel around first. Okay. Just make sure there's no lumps, bumps, anything that I need to be concerned of. Perfect. Okay. So again, I'm going to listen and we're going to start off with your lungs. As I move, go ahead and just take a deep breath in and out for me. Okay. All right. I would be doing this from my my stethoscope to skin. Okay. All right. So go ahead and take a deep breath. Perfect. Now I'm just going to go ahead and move on to your heart, okay? So we're going to start with the aortic. And then we're going to move on to pulmonary. And then we're going to move to tricuspid. And then we're going to mitral. And then if I was going to listen to your apical pulse, it would be for a minute. And I'm also going to do the same thing with my bell here. We're going to go right back up. Perfect. All right. I am now going to inspect your abdomen. Okay. So I'm just going to go ahead and pull this down. All right. And I'm going to listen and then I'll just palpate around. Okay. We'll start with soft and then deeper. And then I'm also going to listen to each section for a minute. Okay. All right. Perfect. All right, now I'm going to palpate here. Just let me know if you're having any rebound tenderness or any pain at all, okay? So we start with soft, no pain.
Nope.
Perfect. I'm going to do a little harder here.
Nope.
Perfect. Then I would also palpate the bladder at this time. Any urinary symptoms such as like frequency to urinate, urgency, odor, pain,
Nope.
nothing like that. Perfect. You can go ahead and pull your scrub down. I'm also just going to show your feet here. Okay. Can you lift this foot for me? Perfect. It'd be there for a minute. I'm going to put it down. We're going to do this one for a minute. Perfect. I'm going to set that down. I'm going to check here. I don't see any edema. I don't see any skin breakdown. Temperature looks and feels good. I'm going to check your capillary refills here. They are also less than 2 seconds. I'm going to check your pulse here. We're also going to do back here. Perfect. Can you push for me? All right, push again. Perfect. All right. Can you swing your feet to the side? Okay. Before I have you stand up, I'm going to listen to your back, okay? This is going to be for your lungs. All right, go ahead and take a deep breath for me. Perfect. Deep breath. Perfect. I'm making sure I'm missing that scapula there and listening to all your lung sounds. Perfect. And then we're also going to listen to that middle lobe here. Perfect. All right. I also inspected your back. I don't feel any lumps, bumps when I palpate now. I don't see any skin breakdown in the sacral area. Go ahead and stand up for me. We're going to stand for about a minute, and then I'll have you turn this way, heels to toe as you're walking. Perfect. You can go ahead and turn around, and then you can go ahead and get back in the bed. All right, and the last section is a little uncomfortable. I would check your perineal area. Okay, so that has been checked. Everything looks good and clean. Are you in any more additional pain? No? Okay. Do you need any of your belongings? No? All right. Well, I'll move them here so they're close so you don't have to get out of the bed. Okay. All right. Do you have to use the restroom at all? No? Perfect. All right. I'm just going to take off my gloves. I will use hand hygiene, and then I will document my findings. Okay? Perfect. Thank you.